The only advantage I see to cream, which is a definitive advantage without debating, no one can debate it, is that it's non-invasive. Nobody is going to be afraid of applying a little bit of cream on their skin like suntan lotion. So it's non-invasive. No one's going to debate that. There are other advantages, perhaps, that some people can debate and some people can disagree on. But this is the only non-debatable, non-invasive. That's it. So it may work for some. Here's the problem. Balancing hormones is a very complex formula. I know we always like to oversimplify the big picture. When it comes down to individually making someone feel better and making sure that they have longevity and a lifelong period of doing this correctly, it is somewhat complex because there's a lot of variables. When you have these variables, you try to control as many of them as possible. You have variables that you're trying to control. It's difficult to control some of them, but we're pretty efficient at doing so. When you add in more variables that are completely out of your control, you're overcomplicating an already complex formula. What are some of those variables? Adherence. Is the patient going to apply this on a daily basis or twice a day? Is the patient's thickness of their skin equivalent to what you're estimating that they're going to absorb? Is the dosing in terms of concentration, in the terms of volume, in the terms of which pharmacy mills it a certain way? All these variables are adding to an already complex equation of trying to create homeostasis. So by adding in more problems into a formula, I'm overcomplicating the formula. If I give you 100 milligrams of cream, you may absorb 20 and Jordan may absorb 80. In 6 months, you may only absorb 10 and he may now absorb all 100. If I give you 100 milligrams of cypionate, you're getting 100 milligrams of cypionate. So I've now eliminated a lot of variables and it gives your provider much better control over your treatments and making adjustments. Number one. Number two, the biggest problem that I have seen with creams in terms of real world application is the risk associated with cross-contamination, with the mandatory celibacy period of about 4 hours to prevent cross-contamination to your partner. If you have pets, if you have kids, these are all real concerns. I have 2 daughters. The last thing I want to do is worry about did I get something on my skin or on my hands that I could transfer over to them. It takes me 5 minutes to do my cypionate protocol twice per week. From a clinical setting, Jordan mentioned SHBG. This is a big one. How do we adjust free testosterone to fall in that sweet spot of 2 to 2.5% or 3% of your total? We know that in diabetic or insulin-resistant pre-diabetic patients, their SHBG tends to be low. So then we need to dose them more frequently in order to prevent the androgenic effect of crushing SHBG further. The creams do that pretty well because they have to be dosed at least once a day. What about the patients who are slightly older, have non-alcoholic fatty liver, have a existing liver condition, or maybe take some over-the-counter medication, and those patients may have SHBGs in the 70s, 80s, or 100, and they struggle to get their free T above 1.5% of their total? How do we get the free T down in those patients? Simple. We could dose them once per week with cypionate for a month to see if we can get that down, and then switch them to twice a week. We can try them at twice a week. We can go 3 times a week. We can play with the frequency of their dosing according to how SHBG responds to the androgen injection. We cannot do that, and we lose the luxury of controlling SHBG with daily cream application. Being that that is one of the biggest factors we're trying to manage for not only health, but how the patient's ultimately going to feel, I think that leaves a lot on the table, and it does a disservice to a lot of people. So in short, again, yes, it can work. I don't think it's the optimal way to treat it. Although, if a guy is absolutely 100% against injections, like I mentioned earlier, we have an older patient with Parkinson's, the guy cannot self-inject. Is his option go on cream or do nothing? Yes, by all means, go on cream.
And I have a lot of guys in that camp because they are more frail, they're older, they're trimmer, their wives don't want to inject them. Cream's great if it works, like I say. Most of my guys so far, it's working. And I totally agree with all the points you made. That's why I haven't switched to cream. I mean, I don't want to add a ton of variables in when I know shots work. What else were you saying about the SHBG thing? I don't worry about the higher guys because we can overcome that with more testosterone. I mean, I know that sounds, increase the dose, but if you're just going for symptom resolution, you can kind of Because over time, the SHBG will fall, other things being equal, because androgens will push that SHBG down. Now, yeah, if they have a liver pathology or something weird, that could definitely be a confounder. But overall, I don't worry about the higher SHBG guys as much as I do the super low. Those guys, and those guys need, honestly, a daily dosing. I can't get most of those guys to do that unless they do the cream. So like my diabetic guys, SHBGs in the single numbers, they're going to probably feel better with a daily dosing. They don't want to do injections. So, hey, let's do the cream, because you're going to get, you're not going to burn through your testosterone.